There's an interesting kind of debate going on, and maybe it's not on a national level, but just within some circles I'm in, which is plant medicine is more and more being looked at as a means of therapy. The argument is with some therapists saying, well, that you can't just only do plant medicine, that there has to be integration, and the integration is using traditional therapy modalities. But I've been experiencing some plant medicine ceremonies. The best way I can describe them is they have been astounding in the changes that have happened to me, but just truly almost mind-blowing, truly profound. What drew you towards plant medicine? What kind of healings are you seeing from it?
I have been researching stress for years, right? Ever since I researched stress in women in labor. Just at that time, started writing the book that you see over my shoulder, the Master Stress Reset Your Health book. So I was in the midst of writing about how can humans recover from stress. I don't go with this concept of managing stress. Managing stress is like just treading water. We want to be surfing the waves, living our best life, feeling our best, living our passion, spending time with people we love, and improving our health. That's not just treading water. I want to go beyond just managing stress. I want to help people to master their stress. And at the same time, it just so happened that in my life, I was going through a very stressful time. I was dealing with a different health issue, arthritis, it turned out to be, but at the time we didn't know what the diagnosis was. So I was in the midst of this diagnostic process, and it was the middle of the pandemic when a friend of mine, said to me, hey, I found a shaman in Peru that I trust. She and I had already been talking about ayahuasca for years because ayahuasca isn't plant medicine, it's an herb. As herbalists, we were like, we would like to know more about this herb from the Amazon. And so we were looking for an opportunity. And it just so happened that she found this shaman at that time. And I said, I'm in. And I just went off the diving board into the deep end and said, I'm going. And I just booked a ticket to Peru during the pandemic because I knew I wanted to research for the book and I needed it for my own healing. The first day, the first ceremony that I took ayahuasca, I came out of that ceremony and I said, this is the medicine I've been looking for.
I have to agree. I did ayahuasca once. I was only able to do one of 2 days. It was a 2-day ceremony, and I was only able to do one. I understood what people meant. Like, it's not a drug, it's a medicine. It talked to me. I saw very clear images. I was told things that were beyond my current knowledge. It was profound. I can't stop using that word about it. Plant medicine, just so anyone who is unfamiliar with that, you're going to hear terms like ayahuasca, you're going to hear psilocybin. It can also be other things like 5-MeO, right, which is also known as bufo, MDMA. There's so many others. I'm not mentioning all of them, but there's a lot of these things that I know when I was younger, I saw as a drug. LSD even. Like, I saw this as a drug. And now I'm experiencing them, these modality, these medicines in ways that are not drug-like, that are very therapeutic and very deep and profound. I'm going to keep repeating that word, profound.
Well, I'm in a training program right now. I'm just completing a certification program in psychedelic-assisted therapy. It's a training program through IPI, which is the Integrative Psychiatry Institute. So this is a mental health institute in the United States that's offering a whole program to therapists. And I'm in the first cohort of medical providers that are not therapists that are completing this psychedelic-assisted therapy program. And so we're seeing more and more providers, even from the standard medical system. Like, I'm in a class with ER doctors, gynecologists, all different practitioners, pediatricians, and we're in this training program together to say, hey, we can see that these medicines can help people. And as healthcare providers, we see the limitations of how we can help our patients. These doctors that I'm in class with are saying, hey, I've been trying to help my patients, and I'm seeing that there's only so much I can do with what's available in the standard medicine and the pharmaceutical industry. And so they were wanting to bring these medicines to become more available. As you said, I also grew up during the war on drugs. And so these drugs were categorized in Schedule 1 several decades ago. And that's why they are not been available in the United States and in terms of illegal ways to get these medicines. But that is starting to shift. Now, for example, Oregon and Colorado have approved certification for use of psilocybin. Psilocybin is from mushrooms as a psychedelic substance from mushrooms. MDMA is having having so much research being done. They're hoping to fast track that. And the idea here, James, is not to just make it available for everybody, free for all recreational use. This is very much for medicinal use. And as you mentioned, it's to be using the substance along with support to integrate what we receive from these medicines. It's not that a person's just going to use a medicine on their own and be all on their own with their insights. All of these substances, when we research it, it's done in a very intentional way where you're working with a therapist or a provider before, so you're prepared, during your session, after, to help you understand what you experienced and how to integrate it into your life going forward. Most of the research is on stress-related conditions, PTSD, which is post-traumatic stress disorder. This is where these substances are being used effectively. It's also being used to help with anxiety and what is currently being referred to as treatment-resistant depression. When they say treatment-resistant depression, they mean that the pharmaceutical drugs are not helping the person. Of course, we can't expect these pharmaceutical chemicals that are just to deal with the receptors to solve a person's depression. We need to help the person in a holistic way. I really believe that that's where these medicines are different, is that they are helping us in a more holistic way to actually help our bodies heal and recover from stress instead of just making us dependent on a chemical substance for the rest of our lives.
I think that is such an important distinction. It kind of brings us full circle back to the pharmacy discussion, which is when you were mentioning pharmaceuticals that A, you're dependent on, but also B, that have a lot of side effects. The one side effect that I'm aware of is that you can get dehydrated a bit, which just means you got to increase your electrolytes or your intake of fluids while you're doing it or right afterwards. But even there are some more and more health practitioners that are helping people that are doing these medicinal journeys to prepare for them with vitamins and minerals. Are you seeing any kind of side effects that people need to be aware of should they go down this path?
Sometimes in the midst of taking a substance, there may be symptoms. Psilocybin, for example, some people feel a little nausea. Same thing with ketamine. Ketamine, by the way, is considered a dissociative anesthetic, and it is legal in the United States at this point in time, and it is used in a therapeutic way. But even ketamine for some people can cause some nausea. But the key factor is that none of them cause symptoms that are ongoing. Less than 1% of the time that someone might have ongoing symptoms after taking one of these substances. Also, they're not addictive. Say, for example, ayahuasca, psilocybin, these are not considered to be addictive substances, and the treatment is not something you have to take every day. So it's very different than what we usually think of as, right, when you go to the pharmacy and you get a pharmaceutical and you have to take this pill every day, and a lot of times you have to take it at the same time of day every day, and if you don't, you're going to have withdrawal symptoms. It's very different than that. These medicines are used in a therapeutic window. Depending on the case, it might be 1 or 2, or in the case of MDMA, sometimes they're giving 1 dose per month over 6 months. So there's specific protocols that are used, but as the person recovers from their symptoms, then they're no longer needing this substance anymore. So it's a very different treatment protocol versus a daily pill. And the likelihood of any kind of side effects or dependency is very low. There is a slight, dependency possibility with ketamine. This is why it's so important to work with a provider who can help you to make sure you're using it based on the protocol. What's going to be effective? What's going to help you heal so that you can then go on with your life and not be needing a substance all the time.
If you enjoyed the clip from the podcast, make sure to check out the next video up here, or head over to watch the full episode down here. And before you go, don't forget to hit the subscribe button. Come on. Yeah, thanks for watching.